Heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. One person dies every 34 seconds in the United States from cardiovascular disease. There are many types of heart disease, and each one has its own signs, symptoms, and treatment. About 697,000 person in the US died from heart disease in 2020. That's 1 in every 5 deaths. For some, lifestyle changes in medicine can make a huge difference in improving their health. For others, they may need surgery to make your ticker work well again.
A myocardial infarction, commonly known as a heart attack, is defined as a death of an area of myocardium due to prolonged ischemia, more than 15 minutes, induced by coronary thrombosis or spasm. The most common symptom is chest pain or discomfort which may travel into the shoulder, arm, back, neck, or jaw. The discomfort may occasionally feel like and be mistaken with a heartburn. Cause of death from myocardial infarction is usually due to a mechanical failure or cardiogenic shock and ventricular arrhythmias. The most prominent risk factors for myocardial infarction are old age, smoking, high blood pressure, diabetes, and total cholesterol, particularly high LDL. When handling a myocardial infarction case, there are lines of treatment that should be followed. First is to transfer the patient to nearest IUC or CCU as fast as possible. And during the transfer, the patient should receive the following: a cardiopulmonary resuscitation in case of cardiac arrest, oxygen and IV fluids only when required, such in case of hypotension, nitroglycerin sublingually up to 3 doses with 5 minutes interval in between, or as percutaneous patch, and morphine sulfate for severe pain and pulmonary edema.
Heart failure, also known as congestive heart failure and congestive cardiac failure. It is a set of manifestations caused by the failure of the heart's function as a pump. The signs and symptoms of heart failure result from a structural or functional abnormality of the heart. This abnormality disrupts the heart from filling with and ejecting blood during each heartbeat. Excessive pressure as in hypertension. Volume overload when there's a mitral valve incompetence. Or a diseased myocardium as in case of myocarditis. Symptoms of heart failure manifest as dyspnea on mild exertion, cough, fatigue, swelling of lower limbs, anorexia, nausea and dyspepsia due to congestion of the GIT. Diagnosis for heart failure is confirmed using an echocardiography. For treatment of heart failure, drugs such as vasodilators may be used in combination with diuretics and inotropic agents, and these are drugs that increase contractility, hence increasing cardiac output. The term congestive heart failure is often used, as one of the common symptoms is congestion, or buildup of fluid in a person's tissues and veins in the lungs or other parts of the body. Specifically, congestion takes the form of water retention and swelling, both as peripheral edema and as pulmonary edema, as well as ascites.
Angina pectoris is a chest pain or pressure, a symptom of coronary heart disease, usually due to insufficient blood flow to the heart muscle. Angina is usually due to obstruction or spasm of the arteries that supply blood to the heart muscle. Basically, there are 4 major types of angina, and they are stable, unstable, variant, and microvascular angina. Stable angina is the most common type and occurs only when doing a physical activity. It happens due to coronary atherosclerosis, where the coronary lumen is narrowed and fixed. Unstable angina, which occurs on mild exertion then on rest, is a result of progressive occlusion of coronary artery on top of atherosclerosis. Variant, Prinzmetal, or vasospastic angina can occur at rest and usually accompanied by arrhythmia. It's due to reversible coronary vasoconstriction, result of a supersensitive coronary. A supersensitive coronary is when a coronary artery overreacts to endogenous vasoconstrictor chemicals, such as adrenaline. Treatment of variant angina is usually done using coronary vasodilator drugs. Major risk factors for angina are diabetes, dyslipidemia, hypertension, obesity, physical inactivity, and prolonged psychosocial stress.
An arrhythmia is an irregular heartbeat. It may feel like your heart skipped a beat, added a beat, or is fluttering. It might feel like it's beating too fast, which doctors call tachycardia, or too slow, known as bradycardia. Or you might not notice anything. Arrhythmias are divided up by where they happen. If they start in the ventricles, or lower chambers of the heart, they're called ventricular arrhythmia. When they begin in the atria, or upper chambers, they're called supraventricular arrhythmia. Supraventricular arrhythmias include premature atrial contractions. These are early extra beats. They're harmless and generally don't need treatment. Atrial fibrillation, or AFib, where the upper chambers of the heart contract in an unusual way. Atrial flutter. This is usually more organized and regular than atrial fibrillation. It happens most often in the first week after a heart surgery. Paroxysmal supraventricular tachycardia. This is a rapid heart rate, usually with a regular rhythm. And it begins and ends suddenly. Accessory pathway tachycardia. You can have a rapid heart rate because of an extra pathway between your heart's upper and lower chambers. AV nodal reentrant tachycardia. This is caused by an extra pathway through a part of your heart called the AV node. And it can cause heart palpitations, fainting, or heart failure.
While ventricular arrhythmias include premature ventricular contractions. These are among the most common arrhythmias. They are the skipped heartbeat that many of us feel sometimes. Ventricular tachycardia, or VTach. This is a rapid heart rhythm that starts from your heart's lower chambers. Ventricular fibrillation, or VFib. This happens when your heart's lower chambers quiver and can't contract or pump blood to the rest of your body. It's a medical emergency that must be treated with CPR and defibrillation as soon as possible.
Cardiomyopathy is a group of diseases that affect the heart muscle. It is a general term for diseases of the heart muscle, where the walls of the heart chambers have become stretched, thickened, or stiff. This affects the heart's ability to pump blood around the body. Cardiomyopathy can lead to heart failure. The main types of cardiomyopathy include dilated, hypertrophic, and restrictive cardiomyopathy. Some cases of cardiomyopathy can be diagnosed after various heart scans and tests, such as electrocardiogram or ECG, echocardiogram, and MRI scan. Some people who experience significant emotional or physical stress, such as bereavement or major surgery, go on to experience a temporary heart problem. The heart muscle becomes suddenly weakened or stunned, causing the left ventricle, one of the heart's main chambers, to change shape. It may be caused by a surge of hormones, particularly adrenaline, during the period of stress. And this case is known as the broken heart syndrome.